follow with you. What did we do? Well, we brought together academia and industry to A, champion the science, the best practices, and evidence-based solutions. B, drive and support academic research. 3, create a network where project members can exchange and collaborate. And 4, create a platform from which to bring healthcare environmental hygiene into the spotlight. And that's what we are doing. Now in 2021, if I look at numbers of activities that are activities of clean hospitals, despite of COVID, we were very busy. As you see, 7 peer-reviewed publications, 20 conferences in person or remotely, 2 teleclasses and webinars. We had on webinars like over 88,000 demands. Teleclasses on COVID and fake news, where we had a great attendance, live sessions. We had 2 digital days. We had 1 global clean hospitals days, and we had a book chapter that we wrote. Now, publications for those interested, but I won't take time onto these, are summarized on the next slides. These are the publications for the last 2 years. You can see here and you can see here. I guess we'll be sharing those slides so you will have access to these publications that we did. We also celebrated, and we will celebrate, and we are continuing to celebrate, and I would like you to mark on your agenda the so-called Clean Hospitals Day. 2020, it was specifically focused on COVID-19. In 2021, it was focused on cleaners, the role of cleaners. We had teleclasses, we had a lot of access, we had webinars, we had company involvement, we had social media activities. And the Clean Hospitals Day was on 20 October 2021, on the 2022 later. Now, where are we today is the next question, the next issue I want to summarize with you. Well, we are continuing our research and academic work. We are expanding our network and connections with industry. We are finding new ways to champion healthcare, environmental hygiene, and patient safety. So we could on the same thing that we from the beginning. Next slide. Sensitize the whole world to environment are important. Hyper mobile the environment. The good news is that hygiene and IPC awareness have been increasing during this period, and we should not waste a pandemic, as I would say. You can look at our publication. We published in ARIC, Impact of Environmental Hygiene Intervention on Healthcare-Associated Infections and Colonization, a systematic review, the very best in this field. You can access ARIC. The main conclusion were that the healthcare environment is important. There are numerous healthcare environment interventions that healthcare-associated infection and healthcare-associated infections. Pilot survey on healthcare environmental hygiene that we conducted at facility level using a scoring system that we are developing at ICANN to use. Now, pilot survey results shows to us that healthcare environmental hygiene for 51 of healthcare facilities were majorly lacking in at least one of the components of the multimodal strategy. We design and support facility improvement by really developing a new scoring system. You see here on the left-hand side, the hand hygiene self-assessment framework that we use to actually model a healthcare environmental hygiene self-assessment framework that we are currently developing. We are in the second pre-testing phase, and soon the tool will be ready for use. We have a Gantt chart as well as developed countries. Is to try to answer where we go. Where do we go with this clean hospitals strategy? I tried to show you that we are coming from clean hands. We are now moving to clean hospitals, and we are using the model of clean assessment framework. This tool for you at each individual level to monitor the way you're able to provide safe healthcare environmental hygiene. We are organizing the Clean Hospitals Day conference on the 20th of October 2022.
Recording in progress.
We want to be able to reach all of you and to help all of you. We keep the momentum post-pandemic so that at least, speaking of the safety culture, hospitals would be inclined more than they used to invest into clean hospitals, which is so important. Now, the Clean Hospitals Day on the 20th of October 2022 is a very exciting day, a very exciting program. It's a raising awareness day. So you could all participate using social networks. Of course, on this 20th of October 2022, we'll share with you materials. You need to spread the word, and you need to continue to educate, and you can have specific activities at your institution to celebrate this Clean Hospitals Day. In Geneva, we will have a one-day conference. Environmental hygiene must be flexible, agile, and based on best practices. It needs to include all types of healthcare facilities, not just hospitals. It must take into account logistics, production, quality control, communication. It needs international standards for products and procedures, and it needs to include having plans in place for emergency situation from the international level to the facility level. This is extremely key. Now, today I try to summarize for you from clean hands to clean hospitals. Where did we start? What did we do? Where are we today? And where do we go? Now, if I can summarize it in conclusions, from clean hands to clean hospitals. For clean hands in orange, clean hands showed the way to go from 1995, so many, many years ago. Reviewing the evidence and building intervention strategies was extremely critical. And that's what we do today. And monitoring performance, progress, and time trends ensured improvement and sustainability within the Clean Hands program. Now, if I parallel these to Clean Hospitals, what could I say? Clean Hospitals was launched in 2018. Remember, only in 2018, and we are in 2022, right? Now, importantly, the model is framed on the Clean Hands model. So we are really framing, using this frame model that was so successful to do it all over the world and succeed. We review the evidence, we develop strategies, we monitor practices, we ensure sustainability, and that's what we want to do. I would like to thank here on this slide the Clean Hospitals partners. There are certainly many more to come that make these Clean Hospitals project very, very important projects for the future of hospitals all over the world, making our hospitals safer. With these, I would like to thank you for your attention and would be happy to answer questions if you do have questions. Thank you very much.
Thank you so much, Prof. Peter, for this very informative presentation on the clean environment and how you have adapted the clean hands to clean hospital concept. And our next speaker is Natasha Mwenda. Natasha Mwenda is a member of the Infection Control Association of Malawi. She's an acting Sustainable Delivery Program Manager working with WaterAid in Malawi and has been managing the WASH portfolio. She has been instrumental in establishing strategic partnerships with the relevant departments in the Ministry of Health. And she is also passionate about empowering community members and marginalized groups to play an active role in the realization of the right to health, and water and sanitation. So welcome, Natasha, and please share with us the country experience for Malawi. Thank you, and over to you.
Thank you so much, and hello, everyone. Thank you so much for the introduction. Are you able to hear me?
Yes, we can hear you.
Okay, thank you so much, Liz, and thank you so much, everyone. I think Liz has provided a good introduction. I'm going to share our experiences as WaterAid in Malawi as we are implementing WASH interventions in healthcare facilities. I think we cannot talk about a clean environment or environmental hygiene minus water, sanitation, and hygiene in healthcare facilities. Next slide, please. So just to give a brief background of the WASH status in healthcare facilities in Malawi. So